What is Medicare? Medicare is the federal health insurance program for people who are 65 and older, certain younger people with disabilities, and people with end-stage renal disease. Medicare covers all generally accepted behavioral treatments where the client has a diagnosable behavioral condition. The types of behavioral health care providers eligible to be Medicare covered as independent or private practitioners are specified in federal law and include psychiatrists and other physicians, clinical psychologists, clinical social workers, and clinical nurse specialists. Marriage and family therapists currently are ineligible despite the fact that MFTs have the education, training, and practice rights equivalent to existing covered providers. Does Medicare ever cover MFT services? Yes. MFTs who are employees of a clinical facility such as a hospital or on staff at a clinical office of a Medicare-eligible practitioner such as a physician or psychologist can provide Medicare-covered services if those services are within the MFT's legal scope of practice. This is called incident to coverage because MFT services are legally considered incidental to those of the billing practitioner, who must be physically present at the clinical facility in case of a need for supervisory consultation with the MFT. Why is it important to win Medicare coverage of independent MFTs? Millions of Medicare beneficiaries, especially in rural and inner-city areas, lack access to Medicare-covered behavioral services, yet independent MFTs practice in many of those locales. When Medicare beneficiaries have untreated behavioral problems, some of those beneficiaries' conditions will worsen, often resulting in costly medical interventions or hospitalizations that could have been avoided if MFTs had treated them. Independent MFTs' ineligibility for Medicare means that the potential needs of many Medicare beneficiaries may go unmet. In addition, those MFTs may not be allowed to participate in private health insurance plans. Of the 5 core mental health professional disciplines recognized by the federal government, only MFTs are not recognized by Medicare. Why is Medicare coverage especially important to early career MFTs and MFT students? Early career MFTs and MFT students have decades of their professional life ahead of them. Establishing referral relationships and a client base are essential if they want to pursue independent practice. Medicare coverage of MFTs could create a major source of clients for many years for MFTs just beginning their careers. What are the obstacles to Medicare MFT coverage? Medicare beneficiaries' access to MFTs would cost federal money, even accounting for MFTs' efficiencies. However, a recent study funded by AAMFT and CAMFT on the estimated cost of adding MFTs to Medicare came in at a lower cost than the most recent estimate of the Congressional Budget Office. What is AAMFT doing to achieve Medicare MFT coverage? AAMFT has obtained legislation to add Medicare coverage of MFTs in every Congress since 1999. Such legislation has twice passed the U.S. Senate and also twice passed the U.S. House of Representatives, but did not pass both congressional chambers in the same session, and so did not become law. While political differences may represent some challenges toward achieving Medicare MFT coverage, AAMFT has a history of successfully engaging bipartisan support for our legislation. AAMFT continues to engage bipartisan sponsorship and support for MFT Medicare coverage legislation. The legislation will not change Medicare mental health benefits nor modify the MFT scope of practice, but will merely allow Medicare beneficiaries to obtain mental health services from a marriage and family therapist. What can you do? Visit www.aamft.org/Medicare to quickly urge your members of Congress to support Medicare coverage of MFTs.